14 individual art therapy studio spaces and 2 big group rooms, and they look like an art studio. So all art therapists, so you see all the art materials around, there's usually paint everywhere, buckets of water, and so if you were seeing me as an art therapist, you'd be making art, and I'd be making art alongside with you too. I don't often think it's great for me to just be staring at you while you're dealing with a lot of your struggles and things, so I'm alongside processing and doing art. And if you don't know anything about art therapy, we do talk. We're not just sitting there in silence making art, but sometimes we are, if that's what you actually need from the time with us. But we may be analyzing, processing, talking, discussing. And so I'm a big, it depends what you need. And so it's really organic when you come into my day-to-day life. And so my day-to-day life is very cleaning up mess, physically, metaphorically, holding that space for you, and just kind of being an art therapist.
What are your sessions usually?
They are about 55 minutes. And then we kind of see our clients back to back too. So one client is going to observe someone else's mess as they kind of walk in, and it gives that human element that we're all in this world together and we're all dealing with something too. So, yeah. Sure.
Before I get this question, I'll let answer as well, but do you find with art therapy there's specific, or there's like generally certain presenting concerns or struggles or whatever it might be that art therapy really helps with a lot more or more effectively, or is a more creative approach compared to art therapy?
I would say, like, I'm biased. So I think like art therapy works for all. But if you were to kind of like nail that down a little bit more, I oftentimes see clients who talk therapy wasn't working, whatever that means, because we really build walls sometimes with our words, and art therapy taps into that unconsciousness. And so when I'm trying to work with clients beyond the words and actually like moving and being proactive within their therapy instead of just passive within their therapy, I think that really helps a lot. But we really do work with people who are looking for that sort of like change and transformation, and really all diagnoses or any sort of condition or struggles, art therapy can really be an asset for. But oftentimes it's like my adult clients who say like, oh, talk therapy just wasn't working anymore, or I couldn't get so far, and then that's when I know that we haven't unlocked the root cause of someone's struggle, and art can really help that kind of come to life. We can monitor our words really well, but we really can't monitor our imagery, and so a lot of things kind of come up in that sort of way. Does that sort of answer that question? Mm-hmm.
I, as a psychologist, work hybrid in an office as well as virtually from home. These are some of my colleagues I get to see in the office. I see usually 6 to 7 individual therapy clients per day. Because I do sessions, I work with adults, and I used to run a group, which was a nice way to kind of mix up the day. Currently I'm not facilitating groups, but I also am our South Asian mental health coordinator, so I am working with other organizations such as this one, or other ways to just outreach folks to talk more about mental health or access, learning what these services can look like and things like that.
Yeah, good.
I'm also a business owner and clinical supervisor, and so I'm also wearing many hats. But I think the thing I'll just maybe speak to that other people haven't is that I do think my own routine outside of the therapy space is really important for me. And so I know you joked about waking up at 8 a.m., but there's truth to that. That like, okay, I wake up. My days usually are between, like I see clients between 11 and 5 typically, 4 days a week, and then do administrative stuff sort of in the other hours. But yeah, like having an exercise practice or being able to go have coffee with a friend or do something like that, do the activities that are really important to me that build my life and my resilience up. I think I found that really mitigates any risk for burnout in doing the job. So part of my routine is also like taking care of myself in my routine as well.
I mean, kind of like going off that question, like is there something that the rest of you guys do specifically for yourself, like kind of like what you enjoy to do outside of just your practice and your profession?
Every Thursday morning, I have my schedule blocked off from 8 a.m. to 12 p.m. just so I can get a workout in, go to Sweat House if you guys have ever heard of that. It's like a sauna cold plunge. But just those few hours, just having time to like meditate and relax and exercise, it makes a huge difference for my week. And I feel like I'm able to show up better for my patients because of that. But yeah, just having a blocked time just for myself.
Sleep, coffee,
Yeah.
planning, a lot of planning. So yeah, see my friends and just try to live mostly balancing the times that I have to kind of grab dinner just as a company every week or so, just to touch base to make sure everything in the practice is kind of where it should be, but for the most part. Good communication, I think, with people that are important to you and talking, just making sure those bridges stay intact over the course of the day. That's a nice thing. So,
My business partner likes to joke that I'm the queen of hobbies. So I do swing dancing when it's nice. I play pickleball. I bake sourdough. I sing in the community choir. So have lots of other stuff outside of my work that I try to do and engage with.
I was gonna say, you know, my hobby is art. If you haven't got the like gist of like I'm an art therapist, I make art. But then I have 2 kids too, so I run around with 2 kids. My kids are 5 and 8. They keep me very active and busy. And so their hobbies are my hobbies, and so like I can play on different sort of like the Wii games and stuff, and like Roblox, and like try to figure out life. As an 8-year-old, that's way different from when I was 8 years old. So they keep me busy. They are my hobby. I like, thank you for sharing that. One day when they're like maybe in college, I'll have my own life too, but who knows about that too. Because I still ask my parents for things.
I'm a dancer, so that has been my consistent outlet outside of work, family, and other responsibilities. And to your point earlier, like words can only take us so far in expression, so dance has always been a space where like body and movement kind of carries that expression beyond what I even think about when I'm thinking of the room. So that has been a really big part of myself.
So what dance you do?
I'm trained in Indian classical dance. I'm part of a dance company here called Amaya Performing Arts in Chicago. We're all women professionals. Most of us are moms, so everyone really making an effort to carve out time to keep that passion.
Cool. So the next question is, what is a strategy you find to be really successful across all patients in producing improvements in symptoms?
I think one of the things that I feel like has been really helpful for me that I don't know if it was necessarily anything that was trained, but maybe have had supervisors who have suggested, and I think I have sort of a natural inclination to it, is to be very radically genuine. And so like I feel like I show up as myself in all of my sessions. Like I'm not necessarily, Hannah the psychologist, I'm Hannah, and that's not to say I'm crossing boundaries with anybody, but just that there's this radical genuineness of if somebody's talking about something and I can relate to it, or I have strategies that I've used for myself that have been helpful, like I will talk through those things. And a lot of people will say like that was so helpful to hear. It's sort of, your terms of a mess, like it humanizes the experience that I'm not, in this role of expert, but just that maybe I learned some other strategies or walked through some things. And so I think being able to share some of that and just show up authentically like that, I would say helps across all presentations.
Yeah, I think that's what I was gonna say too, but I was gonna say the relationship. I think the relationship heals, and I think people need to be in relation with someone who's going to be authentic to themselves and show up for people, and not just show up for the job, but actually show up for a person. And so I work very relationally as a psychodynamic art therapist, and so I'm always showing up as me, and I think my clients know that, and they feel that I truly care about them, and even would put the label of love, because I think love heals, and so showing up really with love and care and genuineness not like a tool or strategy. We are the tool and strategy as therapists.
And that's what the research shows,
Yeah.
is that like regardless of the intervention, regardless of the theoretical orientation, that it's the relationship that people get better.
Sorry, I was just gonna say, as you asked that question, the first thing that came to my mind was like, what strategy or intervention works for all people? And I was like, no, that's not.
Yeah. Freak out.
Totally.
No,
It's
that's a pretty
much
bad
better.
example.
There's not one tool, it really is how you show up in practice. It's ditto.
I think from a medication perspective, I like to give patients autonomy in their care. So I never tell patients this is the medication you take. I always like to give them options and tell them the risk and benefits and let them make a choice that's best for them. And I feel like that really works well for patients where they feel like, we're not pushing medication on them and they have autonomy over their care.
Yeah, I think you're really good point with that, because I think just the way it's worded is an interesting question. I'm not sure that everything works for all people. That's immediately a bit of maybe a challenge to kind of blanket statement or broad stroke that. But I would say, I think you guys get some really good conclusions as to the practice in terms of how you engage with that. I think that's probably the closest answer that I would give to is the idea that if you're showing up genuinely as who you are, the other half of that for me is figuring out where they're coming in from. As in, like, what kind of, in what way do you need to communicate and explain to yourself who you are to someone who their language of understanding is a little different. The models they use are a little different. The ways they think about things are a little different, and how can you present yourself in a way that's genuine to who you are, but in a way that still connects with those individuals, in a way that just inherently your default demeanor might be a little counter to, might be a little racist, it might be just a different cultural or just way in which you kind of comfortably present yourself might be a little challenging to them. In what ways do you need to kind of communicate that who you are in a way that's still comfortable to them, I guess is the best way, I would say, like from a broad basic perspective, like how do you really get started, be open to the idea that we might need to kind of fine tune the way in which you communicate certain ideas so that it kind of sinks in whatever it is the conversation you're trying to have with them, if that sort of makes sense.
Definitely. Yeah, I think I definitely love your guys' answers. It was more of like the philosophical point rather than like the actual practice. And I thought we were going for the question as well. The next question is, what are some common myths about mental health you'd love to clear up?
I think the biggest one is, you don't have to be at rock bottom to see mental health care. I think sometimes when people think about mental health treatment, they're like, oh, this person must really be suffering or something like that. And that's just not the case at all. If you're just struggling with just low motivation, just everyday anxiety, or just sleep, those are all valid reasons to seek mental health care. It doesn't have to be kind of this all or nothing mindset.
I would tack onto that, because I think the irony I've been more consistently talking to patients about is the idea that you're not doing great, feeling awesome, let's call a psychiatrist. Usually it's the other direction. People tend to be downtrending, and if the idea is that I'm going to only use this as a last resort when I've hit some sort of barometer where my life is so bad I have to get mental health care, it's much harder. It takes much longer to pull yourself out of however long you let yourself spiral and get back into. It takes much more work to get back out of that to whatever you perceive your baseline to have been. So I think oftentimes just the way you would go to a gym, the way you would do any sort of self-care routine, the quicker you're able to kind of access and understand that tool if something's starting to go wrong, I actually think easier it is to kind of pull yourself out of it and kind of track to where you think you would like to be. The closer you are to bottom, the more likely it is actually you're probably going to hit bottom, because whatever treatments you're talking about aren't going to kick in, day one we see the provider, then day two it gets better and better and better and better. There's no immediate reverse of trajectory. There's some time where things might get worse regardless of what you're doing before it actually gets better. So I think that just kind of is a sort of good point to think about, is that it shouldn't really be the lower you down, the more severe it is, that's when you have to kind of call it in. It's probably better if you're doing it earlier rather than later, just because it's much easier to get back to where you'd like to be and much less challenging for everyone else involved. So I would agree with that.
I hope I don't offend you guys.
No.
But I think one of the things that I've struggled with and have worked with patients on is this belief that came that if you're feeling a certain way, it's only because you personally have a chemical imbalance. And I don't think that that's the case. I think that there are systemic issues that are impacting people. There are societal, there are cultural. We see we're in an epidemic of loneliness. So I think that people will internalize this belief or come to adopt this identity of I have depression or I have anxiety and it's because of my brain. And I think that that's a bit of a myth, and it's been harmful in many ways to eliminate some of the other reasons that people might be struggling or suffering, and it becomes a very individualistic focus on mental health when it is much more likely a systemic issue or a behavioral issue where there are other things going on besides that chemical imbalance specifically.
I think a lot of resistance or a common myth I hear is therapy is just dwelling in the past, or like going to therapy is just talking about your past, complaining about your past, complaining about your parents, or this idea that talking about negative things is only going to make you feel more negative. But therapy is not just a toxic session, right? We're here to understand the patterns of the past, understand why we're feeling the way we are in order to do something different. And part of that sometimes is feeling a little worse before we feel better. But it's not just hanging out in the past and staying there. So I think that's a common myth.
Sounds great, and I'm just going to speak from the art therapist lens. I think common myth is to come into art therapy is that you have to be an artist, or I have to be creative, or I'm not creative, I can only draw a stick person, and that you're not going to benefit from tapping back into your creative identity. All humans need to access creativity. It's a common thing that we need to express ourselves, and so art therapy is just one of those tools to help you re-engage with your creative self again. That's part of my goal and mission for my whole entire life is how do we make humanity back to tapping into creativity, to really harness that is going to give more hope and joy in everything within our world. So just because you're not an artist doesn't mean you can't benefit from using and accessing the creative process in art through the healing modality of therapy.
Thank you. Does anyone have questions? And even like during the panel, if you have any questions, you can feel free to write them down.
So normally any problem you use corrective action, but is there any specific either like a thinking pattern or practice, like a preventive maintenance kind of thing that actually keep as during the day I always feel like I'm really energetic, positive during like in morning, and then afternoon and evening things change, or certain events can trigger the spiral cycle where it's like take you down. So definitely meditation always helps. So I do every day. But is there any other practice or technique or last resort sometimes medication that can help to keep that mental condition more elevated and in positive sense?
I'm sure I can think of some other ones, but the first thing that came to mind, one of the therapies that I use is called acceptance and commitment therapy, or ACT, and a lot of it is about being able to recognize and normalize our emotional experiences. And so sometimes what we can do is that if we're not in this sort of default happy, energized state, if we feel anxious, if we feel sad, if we feel stressed, we'll think, oh, there must be something wrong, or I shouldn't feel this way. And that's not true. We're complex and we have many emotions, and the metaphor that they use in ACT a lot is to say that you should always feel happy or good is like saying it should always be sunny and 75 degrees. Like, that's just not true. And so I think one of the things that helps me and helps a lot of my clients is just being able to say, well, of course this thing would cause me to spiral, or of course this would make me feel anxious, and that's a really normal response to any circumstance. And so, throughout the day as I'm feeling fluctuations in my mood or my emotional state, that's okay, and that doesn't have to be problematic. Yeah.
I have a question. First, I think it's really cool hearing like how many of you sort of got called to the profession or to your careers based on just seeing a need of not knowing that when you outset that it was what you were interested in, but finding your way. I think it's across the board really really cool. I'm curious along this, like the theme of breaking the taboo, of it started to get touched on when you were talking about myths in the mental health space, but what are things that either you think you wish that people knew that weren't working in the mental health profession that could be meaningful towards breaking the taboo? What do you wish people knew, or like, I don't know, just looking at it from the other side of you're also committed to this cause and committed to making mental health more accessible and better for people, but that there's so many people that aren't working in this space and maybe aren't gravitating towards seeking help. So like, what about the rest of us?
In terms of getting involved with the kind of field, or just different tips, I guess, to feel more comfortable with the discussions or bringing this up with other members of family, or just what are you thinking in terms of that situation?
Yeah, really. So the question came up as y'all were talking about how important it is to show up authentically at work, and that relational interactions are sort of how you can move the needle in mental health, and that it's just like coming from not in the mental health space is like no one that I work with is talking like this ever. And so it's just like this dichotomy, I think, that I am like experiencing in the moment. So I'm just like, that's how I got to the question, is like people in general in the world are not talking about showing up authentically. And so it just like struck me.
I think it's so true. My husband's a realtor, and they're definitely not talking about their feelings. I can tell you right now, I hear it on the phone, I see their colleagues, his colleagues, and they're all stressed, and they're making, it's a lot for them, right? And then for all of their clients too. So I think that one thing is I show up as like an art therapist everywhere I go to some degree. I always tell people I'm an art therapist, so I'm not shying away from like who I am and what I do, which I think kind of starts something, a conversation. But I do think you're like nailing something that's really hard. Once we're in the mental health field, we think everyone is thinking and feeling and talking and able to express their emotions like we do. Like when I go and talk to someone, I'm like, oh, what are you feeling? And they're like, I don't know. You know what I mean? Like, I don't know what I'm
They'll
feeling.
tell you what they're thinking.
Yeah,
And you're like, those are not,
right. Yeah, and so like I'm trying to get more from them, but most people are not. They're not trained like us. And I work with a lot of parents, so I think this might align too. Is I'm working with a lot of parents and I'm just sharing, and I'm educating. I think you talked a lot about psychoeducation, and like so it's just a lot of teaching, and being willing to teach. I think is kind of what I'm thinking about, and teaching and not pushing. My husband still doesn't want to talk about schools, just so you know. As long we've been together for 15 years and he's still not talking much about school.
I also think, I appreciate your question and you sharing how you got there, and I think people are a bit starved for it though, that connection, and so I have also found as I talk even just about that, hey, do you notice maybe it feels hard to connect, or do you notice people aren't showing up authentically, even having some of those conversations at sort of a higher level, I think people are like, oh my god, it's like an oxygen mask at moments, and so I think even just sort of dipping toes into some of those spaces with people in your life, people want it. I don't know if we all know how to do it, or I think it can feel scary, or we're so isolated and in various ways that we haven't been in the past. But I think people really want. We're wired for it. It's in our biology to connect and to be social, and so I think just starting to go there in any capacity opens up some of that space and connection.
I think kind of like any hobby, if you're naturally like getting interested in it and you want to do it yourself and just learn different techniques, behaviors, all this stuff, you'll find yourself interested in it. And the more you do it, the more you'll find yourself talking about it. And then the more you talk about it, friends and people around you are going to kind of know you as the conduit and hub of the person who knows and thinks about these kinds of things. And they'll kind of open up to you about things that you weren't talking about before, because now they know there's someone who talks about this kind of stuff. And when I was telling people like I was going to become a psychiatrist or finish residency, the number of people that just came up with it was just straight like psychiatric questions. They just like found me directly. But for friends and close friends I already knew, they just immediately had questions and things they wouldn't have asked me prior to that.
Yeah.
But I think in the same way we talk about hobbies, people, this is one of the, we'll say positives of social media is a really common thread is you like to watch people that have expertise. You want to watch the best soap maker, you want to watch the best woodcut, you want to watch someone who's very good at that particular skill, just because like seeing shows of competence are very interesting and engaging, especially if it's not something that you know inherently on your own. So the more you're kind of dedicated to authentically, like you're talking about, being this person who enjoys these kinds of stuff, or thinking about these kinds of hobbies, the more people are not going to be like embarrassed or unhappy. They'll kind of see you as like the point of at least closest expertise to be like, okay, if I have a question, maybe this person can answer that. Maybe I can kind of have this conversation. Maybe I can be open about this in a way that I may not have been inherently before. So I think if you're just genuinely interested in that, the more you kind of develop more of that part of hobby, lifestyle, whatever you want to integrate it, I think the more naturally other people kind of reciprocate in sort of subconscious ways. Does that sort of make sense?
I love it. It reminds me of like a revolta.
Yes.
Like dropping a stone, and then like if you can be that one person that you now show up to work because you came here and you authentically talk to someone else, like, and really show up as yourself, it will start to kind of like ripple, and I think it could really be a beautiful metaphor to keep in our mind of like, you know, we are just one stone, but how many people can we affect in some sort of way?
I feel like recently I've noticed like more celebrities or influencers online being more open that they're on an antidepressant or anxiety medication. So just being open, just be like, yeah, I'm on Lexapro. You don't know who's going to hear you, and that can make someone feel more comfortable to seek help.
Or therapy.
Or therapy, yeah.
They're doing any of these other things, and it's very much a like, if the more you normalize it just by making it not a odd topic to talk about, like I think probably more consistently people are gonna wanna just have those kinds of conversations and almost be like excited if they decide to do something similar. So just like with the hobby, like pickleball, and people go pickleball, pickleball, and they'll just walk right in.
I think we were talking about this before too, that I feel like I've noticed more people coming into therapy who are not maybe on a rock bottom that are, and I'm like, I don't even know what diagnosis to give you, like you're doing fine, but they wanna come in and just talk about stuff or work through things, and so, which is great, like, and I think that, because there's a little bit more of that, yeah, just having those conversations with people can, there's more and more people who are open to the idea that therapy doesn't have to be just something that you're doing when you have a serious or chronic situation.
Culturally, I see a little bit opposite, where even though generationally there's so many more conversations about therapy and it's being normalized and it's just something in our schedule, but for people from communities or specifically from South Asian communities where it's not a feeling, we don't talk about our feelings, like love through action, not words. I have a lot of younger South Asian folks coming in who are like, I need to justify being here, so I need to know what's wrong with me. Like there has to be something wrong with me to be here, so like what's the diagnosis, what's the label, versus like I'm having a hard time and I deserve care just because of that. So I think that's something I wish people, when you're like, what do you want other, like the non-clinical folks to know or understand, it's like you are deserving of care and the space regardless of the labels. Like, the labels are, they're not unimportant, but they're not first priority.
It's so interesting hear you say that of like that you wish people knew that like care is valid and it's not necessarily a fix for a thing. That's sort of what I the subtext of what I hear you saying. That it's not to, you don't need you may not necessarily need a plan to fix or treat thing A. It's that you are deserving of care. That's cool.
I think you said something about going to the gym, like maybe that equivalent to that. Like I think that it can be, right, you go to the gym to take care of yourself, you can go to therapy to take care of yourself. Right? It doesn't have to be I'm sick and so I go. It can be this is part of my care routine.
Also,
The first one encouraging. I feel like everyone needs to hear all of this.
I think maybe unintentionally, I think because a lot of the fields just kind of overlap in all roughly the same space, you're going to get a lot of similar sounding answers, at least from a overall bigger picture perspective. I don't think Nicholas is going to come with a very extremely detrimental answer for you that's going to be like particularly pocketed, that's going to be like read you the wrong way. So yeah, I think that it's good that most mental providers are roughly on the same page. I know that if I hear from a patient's therapist or our provider or anyone who's kind of been involved in the case, I don't go into it thinking like, do I have to double check or self check or like prove this person wrong when they're saying like something that would lead the patient astray. So I usually tend to give just benefit of the doubt to most other providers involved in the case, because I think most of them have pretty reasonable ideas in terms of just being roughly on the same page with what we're trying to do, just bigger picture.
So kind of going back to like what you answered earlier, so what advice would you give to somebody that was like on the border of like seeking help due to like stigma, they were kind of like reluctant to actually go and seek help?
I would say the only negative I would kind of give is unfortunately it's not as prevalent in the family pretty supportive, but from I guess the only mentality shift I would give is this. It is rare that in your family you get to become the most knowledgeable person at a specific subject. And this is one of those rare opportunities where if your family is not particularly mental health aware conscious, if you become mentally health aware conscious, you become the pivot point for all that. This person's your finance guy, this one's your relative, your real estate relative, this one's your medical relative, and you become the mental health person that everyone kind of knows you for. And then the generations kind of below that might learn to look to you for that. So I think in terms of just like if you're kind of seeking it and you're concerned about the levels above, I guess my only thought is that you're gonna, just like going to any sort of therapy, you're probably gonna be the only one in your family who has experience of talking on the subject of what therapy is or looks like. And it's not frequently that you get to be the one immediately most knowledgeable person in your field in your family. So it's just a way to think about it as far as I see it.
I guess my thought is because I have a few folks who do have families, like their families specifically are into mental health care, or they've gotten messages from their families that are non-supportive and stigmatizing around mental health care. And I think I do feel like you were talking earlier about people feeling like therapy is just talking about the past, or sometimes people think therapy is just intervention with family. And so I think it's also, recognizing that it can be a space where maybe you can get freedom from some of those viewpoints that have been harmful and negative, but it's not gonna just be like, well, your family's horrible and you should, alienate them. It's also tools of, okay, well, how do you respond to that when you're getting these messages? So it can be a supportive space to get away from some of that stigma or deprogram some of the things that have come from our, and we all have to do it. And I think that's a thing that I'll share with my patients too, is like, yeah, I have stuff that my family has taught me that I'm having to unlearn, and that's okay, and that's part of just being in a family system. So I guess that would be my answer, is that therapy can be a space where you can let go of some of those beliefs that have come in, but it's not inherently a space where we're just gonna say horrible things about your family and your parents think it's your mom's fault. That's not at least what I'm doing.
I think I'd say that it feels bad because it's new. I think for a lot of people taking that first step, it's like, this is uncomfortable, it's new, there are messages why I'm not supposed to do this, am I airing out my family's dirty laundry, like there's all these sentiments around it, but I think similar to, especially a lot of folks I work with, like a lot of things we do are in secret, a lot of things are this kind of double life, and this is one other thing that might start that way, and once you get in the door, you can start to work on integrating. It doesn't have to be like that forever. And so feeling bad is just when it's different.
I would just add, like, at the end of the day, like, it's great to have that family support, but it's also not needed, because at the end of the day, you don't have to accept the same mindset that your family has. So, put yourself first, do what's best for you, and you don't have to necessarily have their support to seek treatment.
So, first time I'm seeing so many options as far as mental health is concerned. Because just like for me, it's like AI. Everybody knows about it, but nobody knows what is AI. Everyone talks about mental health, and there is no specific information about how you can seek one. Because even in past, when I felt really like I need some kind of intervention, and I went to my primary care physician, and was like, it's normal. If you want, you can start some medication. I'm like, no, I don't want medication. I want to know what is a better way to manage this anxiety or the situation I'm feeling right now. So I wish more people know about there are various options which you are talking here, because anyone here, like my company has special teams who can support you during whatever, like call this number, and this company will be our mental health support and this and that. But for me, like as Priya mentioned, like as a South Asian male, you always taught in your upbringing that you don't have any pain, or you don't admit you have pain, because that's a sign of weakness. But now I know that's not about psychological pain, it's about physical pain. Yes, if I get hurt or something, I should still be strong and move forward to protect my family or do whatever. But when you have pain mentally, you should acknowledge that. And definitely family is your first support system, and if that doesn't heal it or that doesn't help, like all these options I never knew about, but you can go for a therapist, or you can have a psychologist who can talk to you in a way to think about this is normal. Because sometimes we feel more pain because we think this is not normal and I can't do anything about it. So that brings you anxiety, sleeplessness, fear. Fear is probably, I felt, the biggest enemy when it comes. Fear of unknown and fear of something really terrible happen, which is not even happening. So thank you for all this, because I just came into help her with this, but I think I have become more knowledgeable and more exposed to real mental health options here.
How would you say like a person should like choose what outlet to go to? Like what do you think kind of like is something that like for each individual basis, like what should they think about and really like go through all the options?
I would say like when patients come to us initially, we always recommend therapy, and I'm sure therapists will recommend medication. So I feel like we work together, because I'll have therapists refer patients to me where I think you should consider medication, and then we'll have patients that come to us be like, I don't think medication should be the first thing you should start with. Start with therapy first. So I think regardless of which provider you see, we're educated and trained to know what is best for you, and we will make referrals if necessary.
Yeah, that's a good question, because I think, I mean, like Caroline, I'm biased too, and I have the interventions that I use that I think are really helpful for people, but I don't know, I think it depends. I think if you find somebody that you're open to working with, that's probably the biggest thing, as we've been talking about. The relationship seems to be most helpful, and if you find you've done a lot of sort of traditional talk therapy and that's not helping, maybe you try art therapy, maybe you try a different style of therapy. I definitely have a lot of people that have done cognitive behavioral therapy for years and felt like, okay, that's not really working anymore, and so then they come and try more third wave behavioral therapy, and then that helps them. Or yeah, I think it just depends, but I think it's, if you can just get your foot in the door and find somebody that you feel comfortable working with, then that's helpful. And this is just popping into my mind, but maybe unrelated to your question, but I also think it's okay then if it doesn't feel like the right fit to try and work with somebody else. That doesn't mean you failed at therapy, that doesn't mean you failed as a client, that just means it's not the right fit, and that's fine. And sometimes it's the right fit for X amount of time and then no longer, and that's okay too. So I think that's also just important for people to recognize that if they get it with somebody and they feel like this doesn't feel right, or I'm not making as much progress I wanted to, that it's perfectly reasonable and encouraged to find somebody else to work with.
I just want to say something to that too. I was thinking about teachers. We've all had teachers, right? And we remember the good teachers that we had, and we remember the really crappy teachers that we had. And like, unfortunately, you're stuck in that grade, second grade, until you're done with second grade. But as a therapist and in this field, like, you're not stuck with that person. And I think I really encourage people to finding that right fit. At my studio space, we do a 30-minute in-person consultation that's free. And the 30 minutes is to come in to see our space, to meet our art therapist, and to really make sure that the relationship is there before you really dive into something. We want to make sure that it feels right as best as you can, because like we've been talking, I believe the relationship heals, the art heals, make sure art therapy is actually what you want. Never want to like hold you back of anything. And so we do report out if it's not the right fit. We make sure we find the right provider. And to, as a person, just never feel stuck. If something doesn't feel right, like trust your gut, and go and change that person too.
Did you have a question?
Oh, yeah, I did have that one earlier. It was kind of, how we were talking about how, sometimes like families aren't supportive of like mental health treatment and things like that. And I was kind of wondering how you all like go about giving a diagnosis to maybe a client who isn't really open to sharing because they're maybe embarrassed because of like what their family will think if they get a specific diagnosis. How you present that to them in a way that it's digestible to them.
I'll get a lot of patients that will come in and be like, so what would you diagnose me with? I usually tell patients, don't worry about the diagnosis. Like at the end of the day, that doesn't matter. Is what do your symptoms look like? What are some treatment options that can treat those symptoms? So I don't focus too much on the diagnosis because at the end of the day, it's more so just billing for insurance. But it can look so different for everyone.
Yeah, I try to avoid my soapbox about diagnosis, but we come back to it twice now, so I'll walk through that. I think a lot of times, quite frankly, the diagnosis is always, in a good way, more valuable to the patient than it is to me. In terms of treatments, in terms of medications, in terms of therapy, in terms of all this other stuff. If you have a set of specific symptoms, and I know of some degree of resolution, treatments, things that are going to help you with the problem, I don't particularly care what the diagnosis is, because if the tool's going to work for what you're dealing with, it's going to work. Your brain doesn't know what the diagnosis is, it doesn't know what box or label we're putting on the problem. If the thing's going to work, it's going to work for what you're dealing with. So more times than not, I'm caring more about the symptoms you're coming in with, and does it align with therapy, exercise, medications. What is it that's going to be helpful for that particular thing? The times diagnoses are effective is when it feels like the patient, and they'll kind of come to with this, it'll create more clarity for their life. That by having that understanding of what, they can put a label and name to what it is they're dealing with, that kind of guides them in the right direction. That's the greatest value a diagnosis might have for an individual. For me personally, outside of very specific, like, key diagnoses that will separate treatments, it's more or less irrelevant in the sense of like, this is more, the diagnosis is more for you than it is for me. So when it comes to concerns about, family, well, medical records just full of seal, but family, people being involved, putting a label on any of these particular things, I would say it is of minimal priority to me, personally, to get to a diagnosis point, than it is to come to a, here's some things you're coming in with, here are some answers I have for you, you can decide, this is exactly what I'm talking about before, how do I know which is a therapy, is medicines, other things. It's more to me, what are the issues you're coming in with, and what do those particular outputs look like? What are those solutions kind of match to relative to what it is you're struggling with? So I would say don't worry about the diagnosis so much, unless you really, really want that, then we can have that discussion. But it's not gonna change things.
I totally agree. I'm glad you brought on this.
Yeah.
No, I completely agree, and I would say the exact same things. And I think one of the things that I see sometimes with folks, and there was sort of a rise of it, I think, with social media and COVID, that people got really attached to diagnosis and became diagnosis seeking. And I think that there's concern for me there, and so sometimes that's some of the work that I'll do with people is how can we let go of this attachment to whatever this label is, and creating an identity around it. You are so much more of a person than whatever this label or this diagnosis is. And you touched on this too. Sometimes it can be an anchor. Sometimes people can go, oh, this makes sense, and now I get it, and there's a name for it, and other people have experienced this, and so that's where I see the value, in addition to being able to bill insurance.
And that's where I always get concerned, hesitant about the diagnosis, is there is sometimes a tendency, and speaking if you have experience or not, sometimes you can tell certain individuals coming in because they want to make the diagnosis their identity moving forward and say, okay, this is the kind of person I am and why, this explains everything that's ever happened to me, and this explains how I'm going to be moving forward for the rest of my life. And those are the individuals who are most hesitant to be like, how does this diagnosis change? What are you going to do if you have this diagnosis? And the answer is just to have it. I'm always a little bit concerned, like, okay, am I just reinforcing something that you kind of just want to be true so you can X, Y, or Z other things is what I will say. Use it as a reason to allow certain unhealthy habits to persist is probably the best way I explain it. Was that? Yes. That's my concern sometimes when it comes to diagnosis.
I guess like follow up from the same questions, like kind of like in this age of like AI and technology where like self-diagnosis has become very prevalent, like how does that like influence your guys' like profession, your job, or like how you go about kind of addressing these things? Like I know even like I've heard a lot like from like when it comes to physical health as well, like this is also very prevalent with like self-diagnosis, and I'm sure it's like even more prevalent when it comes to mental health related situations with social media. So how has that kind of like impacted how you go about getting to like answering these questions?
I think it's a really double-edged sword because I think people having more education about it and maybe then inspiring them to seek help, right? I think we're all grateful for that, and to everything we were just talking about, it can be harmful and damaging. I think for me the biggest thing I do is psychoeducation, and then specifically psychoeducation around this therapy that I use a lot, acceptance and commitment therapy, where a lot of the work is being non-attached to your thoughts, non-attached to a narrative about yourself, non-attached to a story, that you can have psychological flexibility around that. So that's what I use to come into my work is, and some behaviorism, so we're trying to what's getting reinforced for this diagnosis, why is it important to you? And then, with curiosity, like, why do you want this diagnosis? Like, how is it serving you to have this? And sometimes it's, it feels validating to have it, and then we can have that conversation. So I think psychoeducation and curiosity.
You just education. Like for an example, a lot of times patients come in and be like, would you diagnose me with anxiety or would you diagnose me with OCD? And I would tell them, honestly, it doesn't matter because the treatment option is going to be the same. So, are your symptoms going to be resolved from this treatment option? Because at the end of the day, it doesn't matter.
I think too, your point earlier, the way I do things, or when I feel frustrated with all the like TikToks of like if I look out the window at this time, I have ADHD, like these crazy ideas of what it means to have something, like, while that's very frustrating, I think I have found a lot of understanding, empathy, and like, people just want to understand themselves, and they're seeing themselves in these interesting, kind of bizarre ways, so I think the best part about it is it's making people curious about themselves, and they want a context or a framework to understand their experience. And like once we establish or understand that, and to what I was talking about a little earlier, there doesn't have to be a label in order for you to have this conversation with me and to like work through these issues, concerns, whatever it is. I think that helps shed a lot of this like need for the labels. But it's a little scary. I think the number of clients that will use ChatGPT as their like interim therapist between sessions is alarming. So that's something that I haven't quite wrapped my head around, not specific to diagnosis, but just the process of function of the heart.
Yeah, I think AI, in terms of my I've done a good amount of work for other projects around AI. I think a good thing to kind of think about with AI, all the programs so far, it's been kind of continuous threads that it's very good for broad ideas, for big, scalable, interesting things, just just ideas, things to kind of come up with. It really falls apart the more granular you get. The more you kind of delve into tiny specific details, the much more complicated it becomes at accurately providing you with good information and good data. And I think the problem is when you start to narrow that funnel down to like, what should I be doing today? What kind of routine should I do? What should I be doing for therapy? That's where you take the assumption of this really cool grand idea that it helped me kind of come up with like, yes, I should do all these things for therapy. When you start to nail down specific salient tangible steps, it doesn't have nearly as much like accuracy or applicability or like that kind of thing, so that's where it kind of falls apart. So I think it's always good if there's no other option to just start talking, just get used to it. The best I'd say is like, here's a program that lets you talk in a therapy language to someone, to just talk. When it comes to actually things you should be doing, that's what just immediately falls apart, I think is the challenge. So yeah, it's just in its infancy right now in terms of like, where I think it's helpful versus not helpful, and that's what it's.
I think to go back to the relationship piece too, that, you know, in AI, there's no, like, AI's not gonna set a boundary with you that you have to learn to tolerate. You know, AI's not gonna say something to you that maybe doesn't land well, that then you have to negotiate. You're not gonna have a rupture in the relationship that you have to negotiate, right? So there's all this stuff that happens in the actual therapy relationship that is useful to the client and to their life, that they get to practice, that you don't get to practice with AI. It's just gonna validate you, and you can text it at 3 a.m. and it's not gonna say, you know, hey, next time, like, right, like, maybe don't text me at 3 a.m. And those are useful things, I think, for people to navigate, is how do you be in a relationship with people in a healthy and effective way. That's really important for us to know how to do for our mental health, and AI does not give us that, it gives us the opposite of that, so that, I think, is the challenge.
No, that's a great point. Healthy, challenging, boundary setting, in a way that is meaningful with another person, versus a bot which is commercially programmed to create more and more engagement. One thing that I've actually found out, the thing about the AI stuff is, we do intake forms, like why are you here, people come in and all these different things, but I'm used to kind of after 10 plus, 15 plus years of seeing patients, the first question I'll always ask is, what brings you in today? And I'll just go, depression. Blank, nothing, because I think they're more and more used to having, when they engage with AI, you say depression, and then it just unloads a bunch of 4 or 5 questions. Tell me about depression. Are you It wants me to fill in the space for them, because they're now so used to just giving these short, abrupt answers and having some sort of program engage with them further and kind of like pull it out of them, when that's not really what I'm here to do. I'm here more to answer questions. So if you just give me one line, it's going to be a lot harder for me to like delve more deeply into all those different things. But I think that that's something I've noticed as sort of a change in just communication that I think has been kind of correlated with higher AI usage, unfortunately. So yeah, that's just what I'm saying. Good communication on this.
I've got a question for y'all. So we're talking about AI is a very like of the present moment that we're in, and I know that we're in a very difficult moment now. We like just zoom back, and so with everything that's going on, AI, layoffs, countries at war, economy not looking well. There's a lot happening now. So I'm wondering for all of y'all, how have you seen your work shift, like unique to this moment, from maybe before you were in it? And I'm thinking like the work that you're doing, but also how you all make it work yourselves, because we're all living through it at the same time.
I think what I've seen from the medication standpoint, sometimes patients will be like, what about this medication? AI said I should be on this medication. And some of the medications are not even medications I normally would prescribe. So I think that kind of makes it a little bit more difficult. Be like, hey, this probably isn't the first medication I would recommend because it's pretty habit forming, it's a controlled medication. There's other safer alternatives. So I think I have to spend a little bit more extra time being like, I know AI says this, but this wouldn't be the first go-to medication I would recommend.
I think one of the things I've noticed is people coming in and saying, like, I've had a couple of patients that are anxious about the fact that they're having like their own compassion fatigue or their own care burnout, and they're like, well, I don't even want to read the news anymore. I'm like, yeah, that's normal. Like it's overwhelming. It's a lot, and you know, I don't know. I go back a lot to like what's really in our biology and what's in our DNA. Like we are social creatures. We lived in tribes. Like this is how we existed, and so the idea that we are supposed to be able to take on all of these things and care about all of them is impossible. It is not coded into us, and so I think it's been a lot of trying to normalize that for folks and like, okay, can you come back to what are the things that are important to you? What are your values? What's within your sphere of influence and care? because I think that, you know, we're so overwhelmed with so much information and so much really negative and scary information that it's actually not possible for us to care about all of it. It is literally impossible for us to care about all of it.
I haven't been so afraid of AI as an art therapist right now. I haven't actually seen it impact my work. My younger clients, absolutely with their homework. Like, you know, they'll talk about all of their work that they got done, that they made they didn't read the book and blah, 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 blah. So like their grades are different. But in general, like I see so many people in person, and they just, an AI typing on something is not the same source of creativity we're using our hands. So that's a little bit different for me. And when you talk about the world that we're living in, I can just, for me, it brought me back to COVID. It brought me back to being an art therapist. During COVID, I was pregnant with my second child. I was seeing 30 plus people virtually, kids, and so like I just remember the fear base that we were living in, and I think we're right back in that. And so just for me, it's creating just a safe space for all of the clients to come in, and they use art. So I just feel grateful that I have art instead of just language and words. Like we're speaking through the art has been really helpful. So the world feels really scary on the outside, but in the studio we have security, we have transformation, we have things that we can destroy and feel safe in destroying things. And so using all the metaphors and language of art has been really helpful. I don't know if that fully answers your question.
I think that to your point about fear, like during COVID, I feel like over the past several years, the moment has been nonstop. Like you describe what the moment is right now, but there's been a version of this like overwhelm nonstop for years now. And I think that what that fear felt like even 2 years ago when clients came in, I was hearing what's going on in the world right now is really scary, and like I was hearing a lot more of that in session versus now. It's not coming in as much because everyone's desensitized to that fear, which is I don't think I really noticed when I asked that question, which is a little scary.
Yeah.
And to your point of we're not meant to have to care about so much pain and suffering all at once. So no, it's not very uplifting. That's where I'm at a little bit in sessions. At least when I reflect on it.
I would agree. I think kind of going back to your comment about four spheres of influence is my initial thought. It's not a great answer that I have for a lot of people, but I think that when you kind of move it, there's a lot of the outward world that exists out there that's really outside of your control. To a degree, there are parts of your internal that you can control in terms of what I believe, who I am, figuring out where do I stand as a person, what are the things I want to be, how would I like to be, how do I want to respond to these different things. These are things that are actually a little bit more in your control than you think. And I think people don't often spend a lot of time reflecting on that and kind of putting that together. So they're a lot more easily swayed by influences outside of them. That a lot of times they're assigning, kind of constructing an identity based on all these different things that are coming in from an outside external source and trying to build themselves out of that, as opposed to kind of looking inward and figuring out like who they are and then responding to the outward world outside of that. I think that's part of the challenge too, is the more you're looking at all these other different things, trying to figure out all this stuff before you kind of figure out who you are internally, it kind of makes it much harder to do both of those at once, because the outside is always changing. If you kind of have a sense of who you are internally, you can then approach how does this person, how does this individual that I am, all these beliefs that I hold, deal with this situation, this kind of war, this kind of disease, this kind of thing that I'm seeing. I think it feels at least a little more stable because you've got some kind of bedrock. You're building these next moves on top of it. That's kind of been the way that I've thought about this. Because you're right, I think when we were in the pandemic, to be able to spend a lot of time inside where there was different kinds of lacks of distraction, and I think then they kind of reflected when they by themselves, who am I? And it got very uncomfortable very quickly when there was not a lot of easy distraction. And I think that kind of told me people aren't really reflecting on where they are inside first before they kind of move the outside stuff. But then we reopened and it was fine. Better than ever. We're all better than ever. Lots of things to distract ourselves with. So, and I included.
Just the last thing I'll say, because you made me think about this with the bedrock, and I think I don't know if any of us answered, you asked like how do we also deal with it. So for me, it's about going back to values, and so that I'm always going back to my values, what's in line with my value system, and then I'm teaching my clients how to do that for themselves too. So what's important to me? Okay, social connection is really important to me. How am I engaging that in my own life in the ways that I can? How am I engaging in contribution in my own life in the ways that I can? And everybody's value system is going to be different, and that's great. That's good.
I have like building off of that. When you mentioned like we're kind of like not reflecting on ourselves or the things that we like deal with, and I'm wondering like what you guys think about the fact that social media has become so prevalent in our day-to-day life, and whether you believe that that's like preventing us from really like taking a minute to like be bored and things like that, because I feel like we're not really that bored anymore, and if we are, we just go on our phones. Like, what do you think that does to our mental processing?
Nothing good. We were talking about, there's a book up here called The Comfort Zone. I haven't read it, but it made me think of, there's another book that I read last year, 2 years ago, called The Comfort Crisis. And it's, have you read it?
I saw it.
Oh, okay. I really enjoyed it, and it's about, I think he's a journalist, and he looks at different ways that we have, we basically become too comfortable, and that has, so we don't experience boredom, we don't experience, any sort of struggle in, and he talks about it even with food, and like, okay, if you're hungry, there's immediately food that's available for most of us, right? And what does that do to you to constantly have access to things to quell any negative experience that you're having, whether it's boredom, hunger, anxiety, anything like that. We have a solution for it that is immediately available, and so it doesn't build up any sort of resilience. And I think resilience and flexibility, psychological flexibility, are incredibly important for mental health. And so, not to say, okay, go out and do things that are going to make you uncomfortable all the time, but also sometimes do things that are going to make you uncomfortable, and that is okay. It's okay to be bored. It's okay to not have an answer to a question immediately. It's okay to have some anxiety sometimes. It's okay to experience those things.
Yeah, it's 100% the problem. It's a big part of the marketing bodies is to dominate free time and to, chemically fire you up, make you want to see more. It is training both, patterns, showing you algorithm things you want to kind of continue to engage with it, to eat so much of your time because that's where the money comes from. So I think that's 100% a challenge to, if you're trying to reflect at any point without looking at a screen, it becomes very complicated because your brain's not used to that lack of dopamine because the screens are always there because you feel socially disconnected to everybody else. It's an immediate challenge to that kind of thing, and I think that it's not 100%, not saying social media is 100% bad. I'm just saying you have to be very respectful of its rules. It's not there just to be fun or be positive for you. It is a commercialized tool. That's kind of what you're engaging with, and you're making these different exchanges, and the main exchange is the time to reflect and grow. I think that's people don't really think about. It's less about just the time. It's the time you could be using for internal, anything, literally anything else. But they really like that's not the picture. So that's just that's all.
And reflecting on that the art can be its like counterpart, right, to weigh and balance it, because oftentimes I'm starting to notice, right, my clients are struggling if the art piece isn't done quickly, right, so we want instant gratification, and so oftentimes like I can observe a client who wants to make slime, if anyone knows what slime is, but it's instant, right, like so I get the instant feedback, the gratification, I made it, it's done, I can be done with it, I can move on from it. And so sustaining long-term projects, sustaining some sort of flexibility if something gets hard, if it's not perfect, if it's whatever. So like oftentimes as an art therapist, I'm telling my clients that the art studio is like a microcosm of the real world. And so if you're frustrated in art because it's not fast enough, like that's how you're probably engaging in life. And so with social media, I'm starting to notice the more and more people can't get messy. They can't sustain something long term. The lack of creativity has decreased because our brains aren't bored as much to get creative and think about things or have imagination. And so Pinterest now exists, right? So I'm going to go to Pinterest to get my ideas. And so all of these sort of things are kind of like trying to get us away from our creative self, which I could go down a whole thing about why the world wants us to be less creative, because we can expand as humans if we are more creative, but that's a whole other background that I could go down. But art is the tool to combat social media and the presence of that.
I guess like kind of going off that, like as a student I feel like a lot of the times like with all the things that are going on a daily basis, like it's really hard to like step back, take in the moment and reflect, and I'm sure like you guys can all relate to this, like in your day-to-day life there's just a lot happening. There's like not much time it feels like to like go step back and like reflect and actually think about whether or not you need to seek help, whether or not you need to talk to somebody about like what you're feeling. So like I guess like kind of like concluding the discussion, like what would you say is like one thing that everyone should like take out of this discussion or take out of mental health wellness in general, like whether that be like a practice to put in place or like something to do in terms of like advocacy to like help other people realize, just like what is your one piece of advice to like take home after this event?
Don't use AI for therapy. Don't.
Again, I'm thinking about mostly people that I work with who it's a real struggle to get in the door, and a common feeling is like, my family doesn't know how to talk about these things. They don't have the language. Mental health is not a thing. And I think the one kind of tip or thing I would encourage people to do is like take therapy speak out of it. Just like, how are you really feeling? Just asking your parent, dad, your sister, whoever, how are you really doing? Like, I know you just went through this thing that sounds hard. Just like having a genuine connection that does not have to be rooted in like these this is a great conversation, but there's still a lot of therapy speaking here. And just a more grounded human conversation, and you'll be surprised that they are capable of meeting you there. They are capable of talking about their emotions, and it just not be in this language that we're seeing online. So I think that is something that I would encourage people to try to do with them.
I think I would say that everyone's worthy of being seen and heard. I think if we can listen, like truly listen to people and truly see people, it'll be more of a healing. You don't even have to be a therapist. That if you can actually really see someone for who they are and really hear someone's true story, you're going to help be part of our healers. And you don't even have to have the degree that I have. So you don't even have to pay all the money that I do, right? But making people feel truly seen and heard is just so important, and that you're actually worth it, and you sort of connect me.
Yeah, I think I guess just anchoring back into sort of the relationship and that also most of the things that we're experiencing are things that other people are experiencing. Oh, there's something wrong with me for feeling this, or there's something wrong with me for thinking this way, and I don't want people to think that. I think that we're all having thoughts that are hard for us. We're all having emotions that are challenging for us, and just because that's normal doesn't mean you have to do it without support, and that connection and that support is what gives us comfort.
I think just being open, honest, and vulnerable as much as you can. I feel like the people that I chose to connect with the most are the ones that have been able to be vulnerable with me, and the other way around, because I think that's how we connect with others, by being vulnerable, showing, a different side. But yeah, I think just having an open and honest conversation, when you are able to say that, hey, I'm on a psychiatric medication, or I'm in therapy, it makes others feel less alone, and it opens up the conversation for them to talk to you as well.
Yeah, I'll give a more technical answer, I guess, from like a student perspective, I think. Well, I guess I suppose. I think a lot of times it really helps to figure out when you're doing something, like where are you trying to go with it? Why are you actually doing this particular thing? Like what's the end point of all of this? Because I think a lot of the pressure people experience, academic or otherwise, is fear of failure, is because I think that I want to do this thing, and if I fail at it, I'm not going to get the thing that I want. One, are you sure it's a thing you want? That's probably the first question you should be asking. But beyond that, once you know it's exactly what you want, I think it's okay to fail. You just have to understand the failure doesn't mean you're never going to get the thing, it just means more work. You got to do a little more work to come back, you got to take the test again, you got to go back to the class again, you got to do whatever it is a couple more times. And if the idea is that you love this so much that you're willing to do any amount of work to get the thing that you want, then the failure is really not a pressure anymore. It's just, okay, I just got to do more work to get to that particular thing. It takes away a lot of that concern about, am I going to do something wrong? Am I never going to get the thing I want? If you're understanding that you're just willing to put in more work, then there's really a little bit less pressure to do it right or perfectly the first time. You just gotta kind of get more reps, keep doing it, and get more opportunities to kind of enjoy the little journey along the way you get to whatever it is that you're trying to get to with that particular place. That's just kind of my sense from a student standpoint. That was what helped me kind of end up where I am now. So.
Yeah, thank you so much. This was a really, really good panel. I think everyone can definitely agree, very educational, very inspirational. So thank you so much for taking the time out to come and answer our questions today. Yeah, I love this conversation. It was like, I think this is like exactly what we need in society to be able to break the stigma. Because like obviously like we were all able to openly ask questions and like start speaking about it, which is like the only way we can truly learn and have education, like understand what mental health looks like and what wellness looks like outside of just physical health. So thank you so much.
Thank you for organizing.
So that was the panelists. Feel free to kind of talk and like if you have anything specific. All the panelists, they brought like resources from their practices and their organizations. So you can feel free to look at those as well. Very important, very educational as well. And then I'll be going through and like seeing for the raffle winners, the books, all 5 of them are going to go out to somebody today. So yeah.
करना को बंद करना को
I make sure I